I'm Mariah.
Hello, everybody. Welcome, welcome.
Welcome, everyone. Get started in just a moment. Wait for a few more folks to come on in. Francis, just let me know when the waiting room seems to be going down. Okay.
I think we'll have folks trickling in for a few more minutes, so I am
Get
going to go
going.
ahead. Yeah.
Okay, great. Well, welcome, everyone. It's so good to see you here today. Our State and Grassroots Committee orientation. My name is Maureen White. I am an organizational development consultant, facilitator, and coach based in Boston. And I've been working with Open the past few years, supporting the committee work, helping design and facilitate various committee meetings. This will be my first year working with this committee, so I'm really excited to get to meet you all and be part of the work you're doing. Seems like there's some exciting things on deck for this year. Um, so we are going to talk about what we're going to do today. If anyone has questions, feel free to ask. I'll also put our agenda in the chat. Francis, do you want to fast forward to the next slide? Great. So we want to get a sense of who's in the room with us today. So in the chat, if you can share, who you are, where you're located, your role, and just out of curiosity, what advocacy or systems change work is most central for you this year? What advocacy or systems change work is most central for you this year? Go ahead and share that in the chat. Welcome, Dr. Lori Johnson. Ooh, Hawaii. It's a fun one. Got West Virginia, we've got Iowa, we've got Maine, Delaware.
Consider this to be very good weather. It's a little overcast.
Here you, Callie. We do a little bit of everything, so it's hard to choose. Yeah, that's fair. That's fair. I see prioritizing expanded function. Yeah, trying to hold on to what you have through the cuts. I hear that. Yeah. Addressing network inefficiencies in Pennsylvania. Preserving comprehensive Medicaid adult dental benefit against a cap this year. Yeah, great. Lots of great stuff coming in the chat. Thanks to those who've shared. Not going to read them all out because we want to keep things moving, but appreciate you sharing what's on top for you and where you're calling in from. Just a few housekeeping notes. We are recording this meeting. If you can keep yourselves muted when you're not speaking, that would be really helpful to keep, the meeting organized. Feel free to share comments and questions in the chat box. We'll do our best to keep that monitored. And you will get the recording and the slides after the meeting. I know that's always a big question. And if you feel comfortable, feel free to add your pronouns to your Zoom name. Okay, great. Next slide. So just a quick reminder of where we're hoping to end up by the end of today's meeting. So we hope to walk away with alignment around the 2026 committee goals and deliverables. We hope to have a list of framed advocacy messaging priorities. We're going to have some refresher guidance from frameworks on applying framed values and community storytelling approaches. And hopefully we'll have a draft set of framed messages that the committee will develop for ongoing advocacy. And if we have any next steps that get identified, we will have a list of those as well. So again, I put the agenda in the chat. I'll put it here again, just so you can get a sense of how the flow of the meeting is going to go. I'll be here to help kind of just move things along and try to keep us on time. But really, the leads of the committee are going to be doing some heavy lifting in terms of introducing each section and engaging you all. So I think I can turn it over to Bridget here to kind of set the stage for us.
Thank you, Maureen. So I'm obviously Bridget Walsh. I am a Senior Policy Manager at the Schuyler Center in Albany, New York. We are the state's multi-issue children's advocacy organization that works very closely in oral health issues, and I'm also with the New York State Oral Health Coalition. So I'm very excited to be here. I was watching the chat pop up, and so I see there's a lot of familiar faces. A lot of people have been doing this work for a while, and I also see some people I don't recognize. So it's always great to have new people joining. So we're going to start a little bit with an overview and a little background, just to sort of keep reminding us where we are and where we've been. So as an initiative of the CareQuest Institute for Oral Health, Open is a national network taking on oral health challenges so everyone has a chance to thrive. Open members use their unique experiences, knowledge, and skills to lead network activities, creating collective energy that is driving large-scale change. Our members connect in person and virtually throughout the year to share resources, learn from one another, and align on policy priorities. Over the past 2 decades, it seems it's been a long time we've been doing this work. Our network has grown out of a statewide or nationwide conversation among policymakers, providers, public health activists, and grassroots organizers who understand that today's system of healthcare does not work for everyone. They recognize that we must work together to improve oral health and overall health. To achieve system change, Open takes on network building approach and engages stakeholders across the national, state, and community levels to develop strategies for collective impact. And it's nice that we see people from all those levels here today at the meeting.
Let me go back in my room.
Next slide.
That's it.
So I want to just reintroduce this diagram. If you've been with us for a while, you've seen this and you've worked on this diagram over the last few years. This is the continuum of engagement, of community engagement. It was a tool developed by CareQuest Institute that shows us a spectrum of community engagement, starting at the lowest point where groups are marginalized or excluded from making decisions, plans, and processes. And then as you move all the way to the right, you're working towards full engagement or empowered leadership. We've used this tool as our framework for discussing community engagement and alignment. And this is the measurement tool that the state reps utilized back a few years ago to measure their state's level of engagement when we first organized as a state and grassroots committee a few years ago, back in 2024. Next slide. And you can see this little outline here over the last couple of years that there has been a progression from the first surveys that we did in the development of the Grassroots Playbook, right through to the work that we're doing this year in 2026, with that playbook being the bridge between the state and grassroots work and is our guide to collective advocacy. Heather, I'm going to now turn it over to our colleague, Heather. I know she was having
Yep, I'm
there
here.
she is. Okay,
I was just
I knew
had
you
to
were
get
having
off
technical
mute.
difficulties. Okay, there you are.
Thanks, Bridget. So, welcome everyone back to the Grassroots and State Committee. We are moving forward and building on, like Bridget just said, the trajectory from 2024. And I just wanted to go over really our goals. So the committee goal as a whole is that we're going to be using the design, pilot, and delivering of network-wide skills. So we'll build on those pathways. And the way that we're going to build on those pathways is by identifying, mapping, and engaging our state and local partners. And we'll be using framing with frameworks again, practical tools, and real-world examples. And all of this will be rooted in our state and grassroots practices. Go on to the next slide for me. And then just a reminder on our core deliverables. We want to build on the playbook that we've already developed, which is, like Bridget said, that bridge between state and grassroots work. And so developing these evergreen tools and resources, but also designing those learning pathways, those are going to be the two things that we work on designing this year. Go ahead and next. And then just remembering the playbook. So if you haven't had a chance, going back and looking at that playbook is, really important. It helps us to remember how we kind of drafted those certain areas of the 5 levels or phases. And, really building on what we talked about earlier, being able to identify where you are at in your objective learning through these phases, and then kind of plugging yourself in and using it as a resource. And the exciting work is this year we're going to be able to have more resources and learning opportunities to learn from each other in these 5 areas. All right, the next slide, please. And then we'll just reviewing our roles and expectations. So we have the committee leads, and we are responsible for the strategy, alignment, and facilitating these meetings. And then all of you, the state and grassroots committee, are going to be responsible for that co-creation and really using the work that you're doing this year to build learning pathways and draft more resources for the playbook. So it's going to be an exciting time where the leads are able to help you create more resources. And then the committee schedule is going to be obviously starting off today with orientation. And then our next meeting is June 9th. And that is the open house, spotlight and design. And then we have the designing of the core learning pathways. And moving into August, developing the trainings and contents and examples. And then September, we will have another open house and prep for our annual meeting, which will be in October. All right, any questions or reflections on the review that me and Bridget just went over? We just wanted to set the stage. It's been a little while since we've met. We wanted to make sure everyone was feeling comfortable and grounded in the work that we've accomplished so we can move forward in the work going forward.
Okay.
All right, Bridget.
All right.
Back to you.
Thanks, Heather. So we're going to be talking today in our breakout session and with frameworks about maintaining advocacy momentum. As one of the ways we're going to talk about this today is we'll be having some time during the breakouts to discuss which framing elements might work best in different policy contexts. And frameworks is going to be coming up in a minute, but just to remember, we have that responsible management, targeted justice, dignity, and the lock and key frames and elements that we've been working on with frameworks over the last number of years. So we're going to be using our Hill Day policy asks as examples. Next slide. And just as a reminder, that the Hill Day 2026 policy asks involved access to dental care for veterans, protecting essential oral health care by maintaining Medicaid funding and ensuring oral health is represented in federal agencies. I know a number of you are going to Hill Days. That's very exciting. I guess we're going to have a big Hill Day this year, and these are the asks that have come up for that day. So we're going to be talking today about messaging and framing. Next slide. So there's more detail on those three asks for Hill Day. I'm not going to go into detail on these. Francis has put this slide, this information in the notes for the breakout session. So if you want a little more detail, if you're not that deep on these, this will be available for you when you go into the breakouts. But this provides a little more detail on the asks if you're not familiar with the Hill Day work. With that, I am going to turn it back over to our friends from Frameworks. Anna Marie is here, and I will turn it over to you.
Hello. I'm going to share my screen as soon as I can. Okay, share screen. Are you seeing my slides now?
Yep.
Yeah? Great. Well, thank you, Bridget, for the fabulous introduction. We are here, my framing friend Priscilla and I are here today to tell you, to work with you, to share some strategies for making asks. We're keeping this kind of broad. We'll talk to you more about why and how as we go. But let's just say to kick things off, we made a lot of examples. We hope that they are useful. You will have access to these examples in our slide deck. We will share this with you after today's orientation. And we have built in specific time for questions, hoping that with the examples, the questions can be very focused and targeted and rich on the framing choices. So here's my framing friend, Priscilla Benford. This is me. And over to you, Chrissy.
All right, thanks. Thanks, Anna Marie. So I know some of you have been with us over the years or worked with us very closely last year to help to create the new updated toolkit. And we are at Frameworks. We have a new health justice program, and this relationship that we have with CareQuest is part of it. And you can see, the alignment here that what the work that you're doing is so important to the work that we're doing at Frameworks. And the health justice program is designed to help you build a health system that is going to serve all people and advance health justice across all communities. So, in this moment, as you are very well aware, we are navigating an obstacle course of existing mental models, and that makes it really difficult for us to reach our audiences. And just as a quick refresher, I want to talk about the three main mental models. Individualism, which when it comes to health justice, it takes a form of health individualism and this mistaken belief that whether we're healthy or whether we're not healthy has to do with the kinds of choices that we make. It has to do with willpower, it has to do with commitment to health. And we're seeing that message. It spreads in social media. It's everywhere in all kinds of other movements that are only tangentially related to health, like the looks maxing movement, for instance. We've got otherism, which we are, is one of the reasons that closing equity gaps is so difficult. And that's the sense that some people belong to groups that just don't care about health and that there's nothing that we can do to help them because they just don't care. We know that that's not true, but we have to navigate around that false belief. We have to help people understand that that is not true. And then finally, fatalism, which right now, with all the things, fatalism is running rampant. And a lot of times people will encounter our messages and say, I just cannot deal. I don't want to listen to you. I'm overwhelmed. And so we always have to make sure that we are being very concrete about the solutions that we're advocating for, because that really helps to eliminate fatalism. And it's something that CareQuest is really good at, like being concrete about solutions. But it's really important just to think about that, that fatalism is one of the obstacles that we're trying to navigate. So what does this mean for our communication?
Well, one of the things that I feel compelled to say, this is important for our communication. It's also important for us. We need to remember that change is possible and change is, we do this work so that we can communicate to others, but also communicate to ourselves. I don't want to underestimate the importance of remembering. This time together today can be an opportunity to collectively remind ourselves why we do what we do, and remember that change is possible, change is feasible. We can do this. We're a community. We can work together. One of the resources for framing oral health messages that talk this talk and walk this walk is the new and revised toolkit that we created last year. Here's a screenshot. I popped a link in the chat. We really encourage you to dig in there. We made lots of examples, and today, as I said, we're going to be sharing even more examples. We hope that these examples are, practical and helpful. And yeah, I'll just say, also sign up for TA with us if you want one-on-one guidance on applying any of these. We'll talk more about that later. But we have a toolkit. We want to use it. It's only good if it's used. So please let us know how we can help you use this toolkit.
Link in the chat. So because you're going to get a copy of these slides, we put these in here, but we don't want to spend a lot of time. These are the original recommendations. You see there the different frame elements bold on the side that says instead. And then going to the next slide, we've got the new complementary recommendations. And these, were created working collaboratively with this committee to make sure that they were useful to you in this political moment now. So, yeah, let's move on to what we're going to talk about today. So today, three things. Crafting an effective ask. We're just going to talk about like what are the components of an effective ask? What do you want to avoid doing? And we're going to talk about how to incorporate the frame elements. We'll have some befores and afters, so you'll see like what a difference they make. And then we're going to talk about, choosing the right frame element for your ask. And what we're thinking about there is that different people are operating in different political contexts. So some frame elements are really good if you are, say, for instance, operating in a context where there is a lot of misunderstanding around what it is that you're working toward, a lot of resistance to what you're working for versus, some people are in contexts like I am, where people are really excited about these kinds of initiatives. So different frame elements for different contexts, and we'll talk about that in the end. And then you're going to have a chance to work on your asks and applying the frame elements and getting feedback. So that's what we're going to be doing today.
Well, I promised you a little bit of ask context. So the truth is, there's a lot of asks in this work. There are a lot of people to whom you might be making asks. I'm going to click through these as I talk. Some of these might be to relevant decision makers, champions, people who you want to bring along, corporations, foundations, community members, messengers, patients who maybe have a story to tell. We'll talk more about storytelling next time. But there are a lot of asks. So it bears practicing how to ask for things. There are 3 elements to make an ask compelling and effective that we're going to work on today. So these are 3 features we want you to notice in the asks that we share as models and the asks that you craft in your practice as you practice together in your breakout rooms. We want to make sure that they are aligned to an audience, and you do that at the very beginning. Make sure that you know who you're talking to and that they know you are talking to them. We want asks that are clear and specific, and we want asks that are feasible. And that goes back to what Crisilia was talking about before about, feasibility, concreteness, specificity. When you're clear and concrete, people can see how feasible what we are asking for really is.
So when you're creating these asks, and a lot of these are sort of tied mostly to feasibility, when you're asking for support without saying what it looks like, then people might be inspired by the content of your ask and might think, oh yeah, open sounds great, or this thing that you're talking about sounds good, but then they don't know what to do. So you want to make sure that you're telling them exactly what the next step is. And that's also related to this friction, cognitive friction. Maybe the ask is using jargon, so they don't understand what you're talking about, or maybe, like I said, they don't know what the next steps are, or maybe you're asking them to do something now, but they can't. And you'll see in one of the examples, we've got a thing like, can we, is this something that you can support now, or should we follow up with your staff next week? Like there are ways that you can sort of deal with temporal friction, and you would know when you're getting ready to present your ask where that kind of close would be appropriate. Misaligned incentives, when, that's kind of related to making the ask too transactional. And one of the great things about asks, particularly, if you think back to that miscellany and asks that you're making to, the community and including institutions in your community, is like making sure that it's understood, like why, what's in it for them. You want to make sure that you say that. And that's something that at Frameworks, we always say you can use a value to help people understand that. And then, again, just that, saying what we care about, but not how to move forward. So you'll get to see how the asks in the after avoid these traps, and you'll see some of the traps in the asks in the before. So I think that'll make it more concrete, and we should move on to our first example. So this is an example ambassador ask. And I
You
think
want me
it's
to
worth
read?
just sort of going through. Yeah, why don't you read?
All right. When we truly value everybody's dignity and well-being, our policies follow. Because oral health is essential to overall health, we as a society have a responsibility to ensure that all of us have the keys we need to access quality oral health care. That's why Open is asking advocates, providers, policymakers, and community members to stand together around 3 critical and achievable goals. Unlocking doors to oral health for our nation's veterans. We're working to remove obstacles that keep veterans from getting oral health care through the Department of Veterans Affairs. Protecting the care millions count on. We're working to protect Medicaid from further cuts and expanding it so more adults benefit in every state. Putting oral health on the national table. We're supporting stronger oral health leadership across federal agencies, including the CDC and Health and Human Services. By recognizing our different needs along with what we have in common, we can work effectively to build systems that support everybody's health and well-being. Open is a community of optimists and doers. We believe that a healthier, fairer future is within our reach. We invite you to join us by becoming an open ambassador. As a next step, please attend a brief Zoom meeting. You can include a sign up or QR code to learn how you can share this work with your networks, connect others to these efforts, and help keep your community informed and engaged in building a better oral health system for all.
So in this one, we don't know if you really have this ambassador position, but the point is to show, like, if you wanted to approach someone about, you see at the end, sharing this work with your networks, connecting others to these efforts, and keeping the community informed. If you want somebody involved in that way, this is the kind of ask that you would create, which is just kind of saying, this is what we do, this is who we are. You see that there's a direct audience, an audience, specific audience is being hailed there, being called upon. You see there's very clear representation of what it is that we're asking them to be a part of. And then that next step in the end, very clear. And there's different ways to do it. But in this one, we're imagining the next step being a Zoom meeting. So this is just an example of an ambassador ask. And here we've got an example of a policy ask. And I think let's leave this for just people to look at when they look at the deck.
Okay, so hopefully you noticed, but now we'll dig in with a little more detail. That the example that we shared with you had some frame elements embedded in there into that ask so that it felt all these things that we said feasible, it felt inviting, it felt accessible. These are some of the frame elements we're going to be working with again today. A reminder that these are at the end of the toolkit, you have what we call reframe cards. So you can download those. We've seen our partners sometimes have those taped to the wall of their office behind their computer so that you can use the reframe card. I use them. We used them when we were creating these examples in the last few days preparing for this presentation. The reframe cards give you, all of the reasons why these elements work the way that they do. And remember, we didn't have time to get into all of it, but these are all tested. Everything we recommend at Frameworks, we recommend because we've rigorously tested these frame elements to see exactly how they help build specific dimensions of understanding and engagement and buy-in. So keys to oral health: responsible management, interconnectedness, targeted justice, dignity, and ingenuity. We won't spend a lot of time talking about ingenuity today, but ingenuity is absolutely everywhere. And if you're stuck and you don't know what to do, ingenuity is always a go-to for you. Just the idea that can we can solve tough challenges. We have to remember we've solved many before and we can do so again. Anything else you wanted to say, Christy, about the frame elements now as we're getting ready?
No, because I think in the examples we'll get to see them in action, and I think that'll help make everything concrete.
Beautiful. Okay, so we read this before. And I mentioned that you maybe noticed some frame elements. Maybe you noticed these.
Yeah, so if you look at the top, you'll see the first one is a way that's dignity, the frame element dignity in action. And then we see our old friend oral health is linked to overall health coming next. And then we've got keys to oral health. So then coming down with the veterans, we get a repetition of the frame element of keys. And you see how keys can be done like when you're talking about removing obstacles or, so unlocking doors, removing obstacles, giving keys, these are all ways to use it. One of the great things about keys is if you are operating in a context where the I'll just call them forbidden words, are something that people are paying attention to. You probably know that one of those words is barrier. So this locks and keys metaphor is really great if you need to avoid that word because and you'll see in other examples ways that we are using these frame elements to get around that list of words. So, and then finally, we've got targeted justice. So by recognizing our different needs along with what we have in common. And that is a way to talk about equity. The difference between equity and equality, people have a hard time. The metaphor targeted justice, in testing, we learned really just helps people understand that because Americans actually love the concept of fairness and targeted justice helps them understand. So that's why you see here, we believe that a healthier, fairer future is within our reach. Fairer there is, I think there would be a tendency for most of us to want to put equitable there. And that's true. That's really what, equitable, but fairer really works. And I think that I cannot make this point enough. The word equitable, like losing the ability to use that word, is not as big of a loss as we might think it is. In frameworks testing years ago, and then we've been retesting it as part of our new health justice research, we're checking, doing new research, but the word equity is just not a word that a lot of Americans understand. They tend to associate it with houses and money. And so it can be very confusing, even if a person is actually completely on board with closing equity gaps, reducing disparities. Um, they might not know what that word means, even if they're completely on board with the concept. So, really think about that whenever you want to use the word equity. If you can swap it out for fairer, you might be able to bring more people along. So, let's go ahead and stop for questions before we get into talking about frame elements in particular asks for particular context.
I see a juicy
So,
comment in the chat here.
yeah, John, changing the term you also distance from 30 years of research. Explain, please.
Sure. I've been working in this field for over 30 years, so have done every civil rights job you could possibly do. And so when you are doing it, the body of research that exists really has names, codes, and other things that really drive that. So when you're switching a term like this, what you have to be careful of is not losing the beat on what actually holds up structurally the work that has been done across academic institutions, across the communities, and so forth. So I am actually much more cautious. I'm not connecting with the new term. It makes sense as a limited use, but really by giving up equity, you're giving up the line where we stand on. We're giving up really the conceptual framework of how this works and also the constitutional variables, right? How the Constitution looks at it. So simply stated, you're giving out the house. And so that's what I'm worried about because when you look at it from a constitutional framework, it's really problematic because you just accept the equality premise that is being driven right now by Justice Roberts specifically, but by the rest of the Supreme Court. And I'm not sure in the long term that is that is the best strategy. So I'm wondering if we're doing a band-aid that will later on will get infected.
I definitely understand that with relationship to the word fair, which people do often interpret as equal. And that is, I mean, as I was saying before, it's really important that we do not confuse Americans about the difference between equality and equity. But that's why we have the metaphor targeted justice, which does do the work of the word equity. And you're right, absolutely. Like the work of equity, the concept of equity, we cannot abandon. We absolutely cannot. But we do, some people are working in contexts where using that word is not going to allow them to actually do the work. And that's the value of the concept of targeted justice. And anyone who is working in one of those contexts and is struggling to figure out how to make sure that they are not abandoning the work or diluting or creating long-term problems by trying to accommodate some of these rules, please come to technical assistance because we can help you because the concerns that John Paul is raising are absolutely like we agree with those concerns, but we think that there are ways you don't have to be um, you can talk about equity without using the word. It's possible.
Heather, we saw your hand, but then it went away. Did we address your
Yeah, I think you
question?
addressed it, but I just wanted to pull it back to the playbook a little and to the understanding of um, state versus grassroots. And so we have a wide level that we're trying to, or a wide gap that we're trying to close, right? And so you have people that are living these situations, and we're trying to um, get that information and be able to share it. And that's what you're helping us do, frameworks, is taking that grassroots level information and sharing it at a level of um, at the state level or federal level. But I do think too that's where those trigger words come in, are at that state and federal level. And so that's where um it's hard to navigate that. So I think all these questions just show that we're right on task of like solving the problem. So
And I would like to just say, if you haven't seen the toolkit, there's a decision tree on page 20 of the toolkit that talks about like if you're, writing and there's a word that you are anxious about, this decision tree can help you decide like, do you need, there are some words that's the only word that will do. And the decision tree can help you decide, am I just going to, commit to this word in this document? Or is there some way where I can use plain language to talk about the concept behind the word?
As a linguist, I feel compelled to say that there are many things, there are many strategies, there are many linguistic strategies besides words that can do a lot of this. I keyed into Jean Paul's use of the word conceptual framework. There are a lot of things that can invoke a conceptual framework besides a word. It doesn't all exist inside of a word. You can do explanation, you can make links to history, you can use other words, you can use frames, you can use visuals, you can use metaphors, all of these. We are here to help you strategize as we you know do the work, but talking the work is a big part of doing the work.
And we've got our examples, and so we can get to
Let's
them
do it.
and we can have conversations about them. And I think that'll be very helpful. So, choosing the right frame elements for your ask.
So our second learning objective today was to well, I guess it was our third, wasn't it? To have uh, give you all the ability to not only know what an ask is and that a frame element can be useful, but which frame element helps do which ask. And this is a nod to one of my mentors, Deborah Tannen, whose research noted that we exist in an argument culture and news media absolutely uh, helps us every day to think that we are in an argument culture. We don't have to be. And we can choose, and I encourage you to, I hope that we will choose that everything doesn't have to be us and them. We are in this together. We need to remember that we're in this together, and we need to be communicating in ways that don't do this othering that this picture so brilliantly tells us. Um, so when we talk about audience stance, we're not only talking about Democrats and Republicans. We want to think about equipping you to be able to communicate in contexts that have more to do with, are you operating in a context where the stance of the people who are listening to you is that of being resistant? Do they reject your view? And then how do you strategize to communicate in that context versus are you in a context where your audience are open to conversation, or are you in a context where not only are they open, but they support your view? So we have three different strategies that Cressilia will walk you through to either equip, right? If you're on the right hand side and you're with people who are you're preaching to the choir, how do you equip them to frame with you? If you're in a context where we are open and we want to be activating new partners, what's needed is explanation. Whereas if you find yourself in a context where you're facing rejection, you want to, neutralize to sort of de-escalate, if you want to think about it that way, and frame for not necessarily for that person, but the people that they are talking to, their audiences. And Cressilia will do this next and probably better.
So we've got, yeah, so that's previous slide was just reminding you of the frame elements, but here, um, let's start talking about communications context. So this is the one where, you've got a lot of people who are on your side. And so your main communications task here are explaining the problem you're addressing and explain how the solution addresses the problem. So this is, easy street, basically, as far as, communications goes. And you see the frame elements that are helpful for those two things. Always oral health links to overall health. You can't use that one enough. It helps people deal with the misconception that oral health is a nice to have, that it's a cosmetic thing. You really want to make sure that you're reinforcing that idea. We want people repeating that everywhere across the nation. Keys to oral health is the one that helps you talk about systemic barriers without having to say systemic barriers. People understand it. It has a persistence, a high persistence rate. When we tested it, what we mean by persistence rate, it means when people hear it, they like to repeat it and they repeat it with accuracy. That's why it's so important to use. Interconnectedness helps you deal with otherness, otherism, where people say, like, I don't need to care about those people over there. I can only care about me and mine because the economy or whatever reasons they have for it. Interconnectedness is a value that you can use. Sometimes you can use it more harshly than others, basically reminding people that no one actually exists independently of you. We are all connected. And that is something, to use it, you have to use some explanation, but it works. Targeted justice is, we saw that in action before. It's another one that allows you to talk about equity without saying the word equity. It's targeted justice, so not just like equality and fairness. It is actually about different people have different needs. A one size fits all approach does not work. That's what targeted justice is doing. And then dignity is saying that we all as humans ought to be treated with dignity. And, it's possibly hard to believe, but we have been testing this metaphor and it works across the political spectrum. People do hold that value. So then you see keys to oral health, responsible management, I haven't talked about, but that one is really just when we are closing equity gaps, we're actually, one, it's the best way to promote public health. Two, we're saving money. There are different ways to do it, but that's the main point there. And then ingenuity is just, when people go, okay, well, that all sounds nice, but I just don't think it's possible. Ingenuity is good in the American context because Americans tend to be proud of this sense that we have a can-do attitude and we can roll up our sleeves and we can actually do hard things. You invoke that, particularly in conservative contexts, and you can get someone to stand down just enough for you to be able to talk. And that's something that we talk about with these frame elements. It's not that people are going to go like, "Oh my gosh, I never now I abandoned all my, my other ways. I'm going to, completely pursue equity based initiatives." No, what happens is they go, "Okay, I'm going to hear you out." And that's sometimes all you need. So, but let's move on to a different political context. So this where you've got a mix of advocates and strong opponents in your state. So you've got a lot of communications tasks, but in bold, you see your main one is you're going to need to engage the unpersuaded. And there, your key friends are keys to oral health, interconnectedness, responsible management, and ingenuity. Ingenuity for the fatalism, if that's why they're unpersuaded. Responsible management, because if they say this just costs too much, I can't deal with other people because it's going to be too expensive. Same with interconnectedness. Other people aren't connected to me. They don't matter. Interconnectedness deals with that. And keys to oral health helps people understand there really are systemic barriers to oral health. People don't understand that. So now, let's say you are in a place where weak or non-existent coalition and obstructions from state agencies and or policymakers, then all the tasks are on your plate. But the two that you really want to make sure that you do, highlight the cost of inaction. And we've got a slide about that coming up. And that's where responsible management and interconnectedness can help you do that. And you want to expose injustice without jargon. And that's where keys to oral health, targeted justice, and dignity can help you with that. So we're going to walk through some examples. You'll see those tasks, in action. But here, I just want to talk a little bit about some research that we did about loss frames and gain frames. So if you are operating, say, in a mixed context or in the context where you've got a lot of supporters, you can use a gain frame. And in fact, gain frames they're great. I mean, they make people feel good. It's like, oh yeah, we can do all this stuff. But if you're in a context where you've got a lot of opponents, then a loss frame is what tends to get people listening when you use responsible management. And so you want to use your data to show how much it costs us to do nothing. Now, you have to be very careful because you don't want to make it seem like the people who are experiencing greater health burdens, you don't want to make it seem like they're a cost center. You don't want to dehumanize them. So that's the trick of using the loss frame. You want to talk about the system that is creating this loss. And then that's why you need to pair the responsible management and your loss frame with a very humanizing value like dignity. Um, and so that the reason is that we want to show respect for everybody and we don't want to waste money. That's kind of the gist of how that works.
So we want to get to practice. I think we have time to go through one of our asks, Priscilla. Which one would you like to pick? One, two, or three? And we will share all of
Let's
these with you all. You will have them.
let's do this one and then
Okay,
just briefly look at the equity one and then get on to group work.
beautiful. All right, you're before, I'm after.
All right, so here we've got an ask. It meets the criteria. It's clear, it's specific, it's feasible. So, federal health policy should treat oral health as part of overall health. As a representative, you have the authority to ensure that oral health is treated as an essential part of whole person care for our country's veterans. Right now, many veterans face barriers to getting preventive and restorative dental care through the VA, leading to untreated disease, avoidable pain, and higher long-term health costs. That is why we are asking you to support the Dental Care for Veterans Act, which would make dental care a standard benefit for all veterans enrolled in the VA health system. Can we count on your support during this legislative cycle?
And then the same idea, but with strategic framing. Healthier mouths mean
Will you
healthier.
click to the next slide just so
Oh,
they can see that?
yes. And then I muted myself. Sorry about that. Healthier mouths mean healthier people. As a representative, you have the authority to ensure that federal policy treats oral health as part of overall health. Right now, many veterans face obstacles to getting preventive and restorative dental care through the VA, leading to untreated disease, avoidable pain, and higher long-term health costs. Unlocking the doors to oral health for all of our nation's veterans would reduce costs and improve overall health outcomes. We can make this happen by passing the Dental Care for Veterans Act, which would make dental care a standard benefit for all veterans enrolled in the VA health system. Can we count on your support during this legislative cycle? So we hope you notice this isn't exactly it's a light touch. It's not a huge difference between what you see on the left and what you see on the right. A few small nods to, maybe you notice keys and doors. Hopefully you notice the connection of oral health to overall health, which we recognize as a consistent communications challenge. But then also a light touch of this, what we've been talking about, powerful tool, responsible management, prevention. When you're talking about prevention, you're talking in the language of responsible management. Shall we click through the next two and then we'll get to our practice?
Yes. So here, if you look at the before, you see, this is about eliminating disparities. You've got a lot of watchwords on the before side. And then on the after side, we've used the frame elements, targeted justice, locks and keys, to avoid using those words, but make the same point. So that's going to be, you'll get to see it when you see the deck. And we can come back to it later if somebody wants to ask about it. And then here is one more. And again, you're seeing here the targeted justice and oral health is essential to overall health is what.
I want to flag this we saw a lot of people in the check-in at the beginning saying that this is something they're working towards. Yeah.
Right.
So we have a few minutes for questions before we practice. What questions do folks have? Are you excited to practice, to get in and practice these? I'm going to take
Any concerns, additional concerns? Or clarification questions?
I guess we could start talking about what we're going to do and maybe the questions that might prime a couple questions, eh? Yes, I agree, Katie. The proof is in the pudding which I learned should be the proof of the pudding is in the eating of it. So we're going to
We've
have you
got
write.
one more box.
Oh, sorry. We will have you write, and we're going to stay together in case questions surface during the first 5 minutes as you start to write out what your ask might be. And we want to encourage you to, if you have a question, pop it in the chat, come off mute. But we'll stay together for the first 5 minutes of the breakout time. Then we'll give you an invitation to a group. And then you'll get into your group. You'll have 15 minutes to share what you're thinking about, hear what others are thinking about, and discuss the process of creating asks and using frame elements to frame your asks. Then choose somebody to share it with a big group. We'll come back to the big group and have 10 minutes at the end to look for themes, learn from one another, ask questions. And our friends Francis and Bridget and Maureen and Heather have all been working to create good handouts for you to have while you're in your breakout rooms so that you have lots of stuff to look at and work from. What else do we need as we're handing folks off to the practice and application part of today? Open friends.
So I think I'm sure that everybody has a number of ideas of how they could craft some messages and apply these. We do have our breakout groups ready to go. So I want to make sure we have enough time for those breakouts. So I'm gonna go ahead and share my screen to kind of prompt what those groups will look like. We do also, of course, encourage for you all to be writing your own messages in your own time and continuing to use the training. But for the purposes of this activity, just moving into the oral health policy landscapes. I believe, Bridget, are you on tap for this section as well?
Yes.
Okay, I will
That's
hand it
okay.
to you.
So I'm
Thank
going to
you.
do a real quick setup because I think everybody's excited to get it and do the breakout, do this work here. So thank you so much for reminders of framing and the real context, which we can use it on as we move forward in this. And just as a reminder of what Heather covered earlier, we're focusing on developing evergreen tools and resources that can be used and adapted. So this work will be sort of the foundation for doing some of that evergreen messaging going forward. So we're going to move forward into breakouts in a minute based on these three policy landscapes. So take a moment and look to see where your state fits in this continuum, whether you have established momentum, you have a mixed landscape, or you have limited traction, because that's how we're going to set up these breakouts. When we move into the breakouts, each group will collectively brainstorm reusable advocacy messages designed around our Hill asks, as we talked about earlier, and the work that we just heard about. And so we want to consider, as you're working your way through this, improving the access for veterans, the Medicaid funding, and the oral health representative and agencies. So you're going to have 20 minutes in your small groups, and when you come back, each group will share one key insight or message direction. So I guess with that, Maureen can open the rooms.
Yeah, and I'll just to note because I think there were some conflicting instructions here. We're gonna go right into breakouts rather than have 5 minutes of solo time. If in your breakout you want to take some solo time, that's totally great. And just as a reminder to the leads, Bridget and Patrick are going to be kind of supporting the established momentum group. Valisa and Jessica will be facilitating the mixed landscape group, and Bobby and Heather will be facilitating the limited traction group. So if those leads could be sure to pick the right group when you get the choice, that would be great. And with that, I think we
And I'll
can.
put the example asks in that Google document so people can just look at them.
Great, thank you. So hopefully everyone's clear on what we're doing. If not, ask a question in the chat and we will answer it. But in the meantime, we will open the room. You'll have slightly less than 20 minutes, just given where we're at with the time. So we can open the rooms.
So the rooms are open. I know many of you are pros at this to be able to join your own. If you're not seeing a prompt, there is a little ellipses button that says more. You should be able to see breakouts from there and then click to join the room that you feel most aligned with. And I will go back to the slide that goes through the different groupings. And if you're still having trouble, you can bring yourself off mute and I can assign you to a room.
Hi, this is Sherry Foreign with Illinois, and I'm on my phone because I'm driving in my car, and so I don't see the breakout rooms. I'm pretty familiar with them on a computer, but I don't see it on my phone.
Sure. Would you be in an established momentum state? Is it a mixed landscape or is it limited traction?
Limited traction.
Okay. You'll be
Thank
whisked
you.
away. No problem.
And Francis, this is
Here it
Frank.
is.
And if you can get me in the mixed landscape group, I'm also on my phone.
No problem, Frank.
This is Jan Gracias, and I don't see anything.
Okay.
I know if you click
Um,
more, sometimes it's in there, but I don't see it there either.
where would you like to go? Mixed
Limited.
landscape? Limited? Okay. Okay. Anybody else?
Yeah, Francis, this is Nancy from Minnesota. I don't have anything either, and I'm used to seeing it, but I don't see
Okay.
anything.
And you can put
Minnesota, would we say established momentum mixed?
We're, either one. Maybe it's, this is tough. I don't want to say I'm established because I don't feel like, I feel like that's being too optimistic.
Okay. You guys have a lot of good nuggets too. Minnesota's got a lot
Okay.
going on. I'll send you the mixed landscape and I think you'll be helpful there.
Thank you.
No
Yeah, this
problem.
is Clarence Jones. Put me in the same group with Nancy.
No
Hi,
problem,
Nancy.
Clarence. Good to see you.
Brittany
Okay.
Shiflett, can I go into limited, please?
No problem, Brittany.
Thank you.
Great, great. Okay. So I think that is all members.
Do we want to pause the recording so the
Oh yes. As long as someone reminds me to restart it.
I
Okay.
think it's still going though, Francis.
Oh, I did press pause. Oh, screen share's paused. Cool. Mhm.
All right, everyone. Welcome back. Looks like you all made it, got sucked back through the vortex into the main room. Hopefully that was fruitful. We have a very, very limited amount of time right now to just hear from each group one key insight or message direction that surfaced in your group. So one key insight or message direction that surfaced in your group. We don't have time to, get a full-on report back of everything you discussed, but luckily everyone can, take a look at the notes from the other groups in that document. So let's start with the established momentum group. What is one key insight or message direction that surfaced in your conversation?
Can take that for us. Thanks, Maureen, and thanks, group. Also, this is you guys had some really good ideas. But kind of the direction that we talked about was one, making sure that people understand that veterans are not able to access. There's an assumption that they're just being taken care of, but this is not included in that. And as a means for responsible management and looking at their overall health, we want to not just take care of part of the veteran, but the whole veteran. And then the other point that was brought up, I thought was really important was is veterans issues in particular is generally a nonpartisan issue. and showing care for our veterans underscores kind of patriotism, the tradition of freedom. And so going in kind of that path is what we talked about.
Okay, great. Thanks, Patrick. How about the mixed landscape group? What's one thing that came up there?
Sure. So our group had many discussions, but with that said, I want to echo what Patrick said. That's a lot of things that we actually touched on too. How do you incorporate that veterans as a whole are not taken care of, and and they've obviously provided a service to our country. So building up that camaraderie and support due to how people think about how we can care for our veterans better and the momentum of our patriotism. And then also the connection piece of adding on the strategy with uplifting that and outlining, especially if like we use the example of Florida, that 66% of the 67 counties, so 66 out of the 67 counties actually have dental health care shortage percentages, and how this overburdens the emergency centers, which has cost Floridians over $1 billion annually. Right. So we were trying to interconnect all the different frameworks, interconnectedness. What does it look like to talk about the health and wealth of folks and how we can bridge those gaps within the framing? And I'll stop there so that we have room for everybody.
Great. Thank you for that. And how about the limited traction group? Do you want to share an insight from that conversation?
Well, I think I had some connectivity issues, but I'll kind of try to paraphrase. So um, it just seems like we don't have a lot of, limited traction. Either we don't have a coalition or, we're just starting to educate on the importance of oral health um, to overall health in general, right? And so we're kind of at that early stage of just trying to get our states to um, add oral health to the healthcare conversation. And so that's kind of what we talked about is how can we, not necessarily stand alone in oral health, but how can we add it to these health conversations that are already happening? So how can we, I like to say sprinkle in oral health. That's just my own phrase, but really like, how do we get the oral health conversation started with all these health conversations with veterans? And so that's kind of where we focus, and we tried to kind of go around and see how many, what states and some of us don't have any representation at the Medicaid level for dental, or only a state dental director but no coalitions. So we have a mix of like states who are just kind of don't really have the framework yet to support. So we're just getting started.
Great. Thanks, Heather. I'll just see if anyone from Frameworks, 20 seconds. Do you have any closing thoughts after hearing these insights from the small group discussion?
I'd like to add, and this is just following on what Heather said, that the oral health is essential to overall health point works. Sometimes you can just say that and people go, oh yeah, I've heard that before. But sometimes, and in the context that Heather's talking about, you really want to spin it out and explain it. And we've got in the toolkit some examples of how to do it. So just like that's a place where explanation can really go far for you.
Great. Thank you for that. Lots of stuff that I'm sure folks will build on and continue the conversation. But we are almost at the end of our meeting. So I am going to pass it to Heather to kind of close us out with just talking about next steps and some homework for you all before the next meeting.
I want to jump in and say one thing real quick, one sentence. If you didn't go to the meeting yesterday, the frameworks, I strongly advise you to go and listen to the recording when it comes out. It was excellent meeting. So
Thank you, Jan. Are you talking about the storytelling that we did?
Yep.
Thank you.
It was great. It was fabulous. Okay.
Thanks, Jan. That gave me enough time to get off mute because I was struggling. So Was it perfect timing? Okay, so just some reminders. We have the virtual Hill Day pre-training session. So mark these dates, making sure that we're, getting ready for Hill Day kickoff, learning about the asks, bringing in the data and making it stick. So these are the training sessions, and I'm sure Francis will get you guys all invited to those, but just mark your calendars, please. And then we have one more slide here. And then just, of course, that we have, the meeting is recorded and the summary will be sent out. And then the next committee meeting is on June 9th. Bring your draft messages so we can check back in with frameworks. And don't forget that the TA sessions, you can sign up for those. Those are great. And then just make sure you're sharing with all your colleagues and network about Open, and they can join the events and also the communities. All right, everyone. Thanks for your time. It looks like we're ending. Oh, right on the dot there, Maureen, hopefully.
One last request. I'm going to pop in the chat a quick link to a meeting evaluation. It's extremely short. It should take you 1 minute to do. It's really, really helpful for myself and the folks that design these meetings and facilitate them to get feedback from you about what worked well, what could be improved for next time. So thank you in advance for taking 1 moment to fill that out. And Francis, any last thoughts here?
And I just want to say yesterday's meeting for this evaluation, before I could write anything, the meeting ended, so I didn't get to do that, which I wanted to.
Gotcha.
Oh, can we send out the evaluations maybe in the recap email as well?
All right.
Mm-hmm.
Would that help, Jan?
Definitely.
Okay.
No problem. Well, thank you all, and all of the pre-training for Hill Day, all of that information will be included in the follow-up. Feel free to reach out with any questions, and I'm looking forward to seeing many of you in DC next month. And otherwise, I'll see everybody on June 9th virtually. Thank you.
Thanks,
Thanks
everyone.
so
Thanks,
much.
everyone.
Thanks, everyone. Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.